Hi, I'm Dr. Rehl. I'm a breast cancer surgeon, and part of what I manage is high-risk patients. And so these are patients that, for whatever reason, we've identified their lifetime risk for breast cancer to be over 20%. This can be based on family history or other risk factors. The whole benefit of being under surveillance is that if there is a breast cancer there, we'll find it early when it's treatable and curable. So a lot of times patients that have small cancers, we can treat it with surgery alone and they may not need chemotherapy. So that's really the benefit of high-risk surveillance. For high-risk patients, there's a spectrum of how we can manage their increased risk. And at one end of the spectrum is really just adding on, in addition to the annual mammogram, adding on breast MRI, which is very sensitive to find any abnormalities in the breast. In the middle of the spectrum, we can use medications to lower women's risk, and there's certain hormone blocking pills that have been studied in high-risk women and shown that if the women take the medication for 5 years, it can lower their risk by 50%. And on the extreme end of lowering risk, there's surgical options, which is removing both of the breasts. And even that, it lowers your risk by over 90%, but not 100, because it's impossible to remove every single last breast cell.